try and share my. Just you can see the presentation.
Yes, perfect.
Okay, so it's really great to hear about what your network is doing, and there are quite a number of things that we're doing similar, and that's always great to hear. So the Mental Health Innovation Network, we aim to support innovation to address the burden of mental, neurological, and substance use conditions worldwide. So basically, we are a community of around 9,500 mental health stakeholders, and we share knowledge, resources, and ideas to promote mental health and improve the quality and coverage of care. We have also been around for 10 years now, so roughly around the same timeline. And basically, when it started, there's a big gap between evidence-based approaches for mental health solutions and the burden. And so we mostly come in to try and fill this gap by accelerating the progress towards implementations of innovations at scale, and then also knowledge synthesis and knowledge exchange. So in terms of knowledge synthesis, where we try and curate mental health resources, or is it research, and then we try and make it palatable and accessible. So for example, there's lots of great research happening, especially in LMICs, and many people don't have access to them. And even if they do have access to them, many people are not able, especially persons with lived experiences or policymakers are not able to read a full research paper. So we try and highlight the key aspects and maybe make it into a policy brief or an infographic, just so that we can get the research out there, and for people to know that there's work being done, and then also to be able to pass across the information that is being passed. So basically, we're an intersection between policymakers, practitioners, service users, researchers, academics, and funders. And it is a collaboration between the London School and the World Health Organization. And mostly once we identify, for example, an innovation, we try and highlight what work it does. And then we also create a follow-up a bit, if it's a project that's just starting, following up on its impact, and people can be able to see there is research. And so this has helped us to be able to focus on LMICs who are not able to get their work out there. And whenever people say there's not much work being done in LMICs, we are able to show them that, oh, here's a list of resources and projects and organizations that are working in mental health in different countries. And so we do have, for example, the Friendship Bench was first part of MHIN, and then it was scaled up through WHO, and it got the publicity it got, and it's been able to be scaled up to more than 30 cities right now. And then so we currently we have two hubs. We have an Africa hub and a Latin American and Caribbean hub. And then we just try and curate all the resources and innovations and categorize them into the different hubs. And for example, the Latin American hub is purely in Spanish. And at the moment, there is lots of requests to kind of scale it up and have Southeast Asian and like more hubs, more people asking for more hubs, more languages, just so that people can know what different resources are available in mental health in different parts of the world. And so basically we have like a member engagement and exchange. So where we do have innovations, resources, and then a community section. And this is all just so that members can learn, interact, be able to access and discuss the different resources. And we try and appeal to different audiences. So as we mentioned, there's a policy makers, there are funders that we do have a number of programs that have gotten funding through being discovered through MHIN, and we also collaborate with different partners. For example, we have collaborated with the SHM Foundation to create what we call EMBA, which is basically they do fund programs in LMIC in mental health and try and scale them up. And then we work together to show the impact that these programs are having. And then we do have a number of partnerships. And then just to give a brief, so in an innovation, we'll just highlight what the program does, what the innovation entails, what the impact is, any references and resources that that innovation maybe has already conducted or is in the process of conducting. And even with this, we are able to also track the like the number of views, like the reach. So for example, they run National Suicide Prevention Program, has gotten to around 45,000 reads. So like we're able to see that these resources, be it those that are presented from like programs or within countries, and then, you know, we share them, and then other countries can be able to also benchmark and create programs or documents that align with the same. So for example, that kind of helped other countries to be like, oh, they have a suicide prevention program, we should also have something in the same. And even like, for example, Kenya recently launched a suicide prevention strategy. So it's able to help catalyze change with people learning from each other. And then so resources is all about different reports that are released regarding mental health. This is where we put policy briefs, infographics, and also we try and summarize systematic reviews. And we also highlight trainings, for example, those by WHO. And then we do have a community section. And in this community section, we're able to showcase blogs, webinars. We have collaborated with Emma's team for the beginning of their webinars. MHIN was part of it together with the Lancet. And we do most of our work in terms with collaboration with different networks and partners, because we are not trying to duplicate the work, but trying to support each other. And then we also have like a forum section where people are able to put any news and events, any funding opportunities that are currently in global mental health, any vacancies in global mental health. And so far, this is our impact, around 9,500 members. And then we normally send newsletters to our members monthly. Around 220 plus innovations that have been listed, a number of resources, a number of organizations, and collaborations to bring about different projects. For example, we collaborated with the International Medical Corps to curate all the mental health MHPSS resources and put them together where you can like categorize them. And then we also do try and highlight, you know, all this research that's happening. We put it out there for people to see using, you know, our social media. And then recently, theory of change was conducted just to see how MHIN is able to support members in terms of delivery, engagement, capacity building, and dissemination in global mental health. And some of the findings, some of the findings were, you know, barriers and drivers to stakeholder engagement, involve contextual considerations, you know, different people from different cultures. You need to put this into consideration, the power relationships, the resources that are available, participation and uptake and stigma. In terms of capacity building, many people do lack training, supervision, and ensuring that there's quality assurance in terms of what goes out there. In terms of service delivery, there's lack of appropriate human resources and expertise, culturally appropriate tools and interventions. And so with this, we're able to create like toolkits to guide people in terms of how do you do a policy brief, how best can you be able to present your work to people. And then at the moment, we are in the process of revamping our website. So it hasn't really been changed since 2012 when it started. So we're trying to revamp it and still make it accessible for people to be able to have these resources. And even those organizations in LMSs that do not really have websites, we can be able to also have them and people to actually see what work they're doing. And then we're trying to strengthen our partnerships and create new and existing ones. And basically our aim is just to ensure knowledge brokering in terms of translation of evidence, and ensuring that we work together in collaboration with different partners, and we don't necessarily work in a silo. Many of the global mental health key partners who are working in the global mental health space, we do work together in terms of be it any release of documents, or like recently the Lancet Commission report on stigma that was been led by WHO, and Emma's team were able to highlight that. So we just try and highlight the different work together, as well as try to ensure the community, like the community aspect, and people are able to have this information. Thank you.
Thank you so much, Joy. I actually find the old website quite updated. I think they're cool and they're good. So, but maybe even better, or maybe not. I don't know. No, but very, very interesting. I have been looking into it, but it's understanding the context helps a lot. So thank you so much. Do we have kind of concrete questions to Joy first? So then we go into the discussions afterwards when Emma has presented. Anyone with concrete questions? It was quite clear, I think. Wonderful, thank you. Emma, I had the privilege of meeting you in Denmark, and I've also had the privilege of, which was very important in our we're now just looking into our state budget these days. There's a hearing next week. But the whole issue of universal health coverage, I had a nice talk with Ali the last week. So, but Emma Thompson, no, I'm sorry, I say that all the time. Emma Scott.
I love it how you keep on mistaking me for Emma Thompson. I wish I was Emma Thompson. She's great.
Yeah, the association went that way, so that's yeah, please.
No, thank you so much for giving me the time to come and speak to you all. I'm sorry if it's a little bit noisy in the background, but my household and my family is full of the flu at the moment, so I had to try and escape, otherwise there would have been screaming children instead of cafe background noise, so I thought that this was preferable. I've also just got some slides that I can quickly try and pull up for you all. Sorry, just give me 2 seconds. Sorry, just get this working on my screen. All right, hopefully you should all be able to see that now.
We do, thank you.
Great, perfect. So yeah, I guess today I'm going to speak to you from 2 perspectives, really. So the organization that I work for is called United for Global Mental Health, but we also founded and act as the secretariat of the Global Mental Health Action Network. So first of all, I can speak to you a little bit more in depth about United and what is it the work that we do and the projects that we focus on. But then I'll also tell you about the Global Mental Health Action Network, which is what my main focus is running and coordinating that network. Yeah, I'm actually based in Copenhagen in Denmark, but you can probably tell from my accent that I'm originally Scottish, and we are a global team. We all work remotely. There's about 12 of us now, So a few colleagues are based in the UK, and we also have colleagues based in South Africa, Pakistan, Uganda, and the Philippines. And so we really do kind of have that kind of global reach and that global perspective into our work. And essentially we are an advocacy organization, so we are experts in campaigning, and we're working to increase the political, financial, social will and support for better mental health for all and access to support. So our ultimate vision is therefore that everyone everywhere has someone to turn to when their mental health needs support. And we achieve that, or try to achieve that, in a variety of different ways. So yeah, probably speaking, preaching to the choir here, but just to kind of highlight our reason for existing, and you can see some of these statistics up on the screen, but yeah, we know that close to 1 billion people across the world have some sort of mental health condition, that globally less than 2% of allocated health budgets are spent on mental health. And of course, we know that in many low and middle income countries, that is much, much less. Young people are disproportionately affected. We know that depression is due to be one of the leading disease burdens by 2030, and that suicide is still prevalent as one of the leading causes of death, especially people aged 15 to 25. And we do have a focus on young people within our work in a lot of our projects as well. So we're looking at some of the key investments that can be made and within mental health, and trying to highlight the positive benefits to society, and yeah, working with a lot of governments, large global funds, philanthropic donors, to kind of highlight this need for investment, and rallying different partners around this cause. So we do in a lot of ways try and convene different partners, and we look at how do we help national partners with capacity building, and how we can work with different UN agencies as well. And we of course work very closely with the World Health Organization through a lot of our work too. So in terms of our strategy and our activities, we kind of we have 4 key pillars that all of our projects fall within. So we have rights, finance, and systems and education. Sorry, I just think that message popped up there on the screen. Don't know if that affects the way you can see it. There we go. So just to give you a couple of examples of our projects under our different pillars, under rights, we focus on decriminalizing suicide across the world. So there are still 20 countries where suicide is criminalized. So we work with national partners across these different countries and help them with their advocacy strategies, and helping them with suicide decriminalization. Under financing, our big focus over the last kind of year has been working to integrate mental health into the Global Fund for fighting HIV and TB. We've worked a lot on the replenishment, and there have been various different resources and work that have been done, which we can send you more information about. Under systems, which is what Heidi would have spoken to my colleague Ali about, he's our key kind of expert there, is looking at the integration of mental health into universal health coverage. So looking and working closely with the UHC 2030 civil society working group, also looking at influencing the high-level meeting that's happening next year for UHC as well. And again, yeah, you can see an example here, looking at the advocacy toolkits and resources that we make in collaboration with our partners, but also to help support the work of national partners across the world. We also have our education pillar, So maybe some of you saw last week, but we were involved in the launch of the Lancet Commission on ending stigma and discrimination for mental health, for example. So looking at how are we supporting the kind of mental health literacy of different stakeholders around the world. How are we working on key communications and campaigns? And under our education pillar was also how the Global Mental Health Action Network came to be. And I'll obviously explain more about that. We also look at what other global opportunities that we can take part in, which help support the education of different stakeholders. And we recently were involved in the International Association of Youth Mental Health Conference, which took place in Copenhagen the end of September, beginning of October. And yeah, of course, the Nordic Conference on MHPSS and emergencies was also something that we were involved in too. So this just gives you, I guess, a kind of little snippet on what are some of the different projects that we have going on. So yeah, really all of this comes down to raising the profile of mental health. We've had various high-level advocacy successes. I've already mentioned the Global Fund strategy. We were involved very much during the COVID-19 work that was being done by the UN, helping to integrate mental health into those key statements that were used by different leaders and decision makers across the world. We work every year on helping to design and deliver World Mental Health Day with the World Federation for Mental Health and also the WHO. We're involved in the ministerial summits that have happened recently around World Mental Health Day. We were just present at the one in Rome, and I've been involved in the past couple of summits. We also launched at the World Health Summit this week. We're part of Foundation Botner's new mental health initiative. So again, it comes back to being able to influence those big pots of global funding and making sure that their approach and their strategy is appropriate, it's including the right partners, and that it's going to the organizations who need it most. And then lastly, just to mention, one of our big focuses is also around elevating the voices of people with lived experience, advocating for their inclusion in key forums, decision-making processes, and helping CSOs in various other ways. We also had a campaign called Speak Your Mind, which involved 19 partners from around the world and supporting them in their various campaigns and projects. And we're still very much convening that network now informally and helping partners across those geographies. So to take a few moments to talk a bit more in depth about the Global Mental Health Action Network. So it's an open community. It's free for members to be involved, and it's for anyone, anywhere really, who kind of has that professional or personal interest in mental health advocacy. And I think that's the big thing to kind of emphasize about our network, which, you know, Joy very much touched upon, this idea of not trying to duplicate any efforts that are happening across the world. So the kind of unique, I guess, or the way that our network contributes to the global landscape is it's because it's everyone who is an advocate or actively working in the advocacy space who comes to our network. So there are now over 2,200 engaged members from over 127 countries. United, as I said, acts as the secretariat for the network. And crucially, the majority of our members are from low and middle income countries, which is also a key part of the network in terms of making sure it's diverse and truly representing global needs and trends. We have 6 working groups within the network. So we have a child and youth group, one that's working on suicide decriminalization, but also now kind of expanding its work to national suicide prevention strategies. We have a global mental health financing group, one on universal health coverage. We've had various degrees of success of also launching a Francophone working group for French-speaking communities, particularly within Africa, and a communications working group. Some of the key activities of the network to point out is that we have a monthly webinar series, which Joy touched upon as well. MHIN were involved in the launch of that series, but now it continues to run monthly, looking at various different thematic areas within mental health. So our next one coming up at the next week actually will be around reflections on World Mental Health Day, and then we have one looking at perinatal, maternal, child mental health in November, and then one looking at human rights in December. So these webinars do pull in quite a large audience of around 200 to 300 members from roughly an audience of around 50 countries, and the speakers very much reflect that. So members from around the world, grassroots organizations, but also combining them with different mental health experts from around the world as well. Every year we have an annual meeting, and this year it was virtual, and we had over 600 members attend across the day. So this is an opportunity for the network to come together, discuss priority issues, key themes, and it also acts as kind of education opportunities as well. We recently launched a virtual community platform called Circle, which some of you may or may not have already taken a peek at, but we'd really encourage people to come join us on that platform. It has 400 members currently on it, and it's very much members kind of sharing in real time. There are different events from around the world, the programs that they're working on, resources, asks for support, opportunities, and ideas for collaboration as well. The network also works on global moments together, so World Mental Health Day, for an example, but we also look at UNGA, the World Bank annual meetings, different global events where members want to come together to coordinate advocacy efforts. And we also look at what education and training opportunities can we work with members on. So fundraising, for example, we ran a session on this year because we know it's a thing that many of our members are struggling with, as well as communication capacity. We did one on the quality rights e-training from WHO this year, and next year we're kind of looking to expand that offer. So I will give Heidi these slides to share with you all after the presentation. You can find the links in there on how to get involved with the network. But yeah, of course, happy to answer questions. And this was just a very brief insight into some of the work. So I hope that's been useful.
Yeah, thank you, Emma. Yes, very useful. I did get a brief from you last time, but this is something about getting it presented where you suddenly understand more connections, etc. So thank you so much. Yes, questions and comments and thoughts and ideas or whatever, just open up not only directly to Joy and Emma, but also to the group and the need for this and how we can utilize it. And so the open discussion. To start off, I could ask one question which is on the sideline of the two of you, but that is kind of what other networks are there? And the way I understand, both of you work in development with a development perspective. So what is the equivalent on the humanitarian side? Just for anyone who wants to answer.
There's a mhpss.net that has a strong focus on humanitarian, and there's also the MHPSS collaborative. Their focus is on humanitarian but youth.
Yeah, I think another one as well is also the Interagency Standing Committee Reference Group for MHPSS in emergencies. A bit of a mouthful, but yeah, they're Fami from the WHO and Carmen, who some of you might be familiar with from the Nordic conference. They're the two co-chairs of that group as well. And then other, I guess, global networks, Heidi, I think we maybe potentially spoke about them, but given the reference you made at the start to the Nordic NCD strategy, there's also the NCD Alliance, who are coordinating a lot of work globally. And then there's also the Global Mental Health Peer Network, which is a lived experience network as well, who is also doing quite a lot of work in this space too. So I think those are some other noteworthy ones to mention.
Thank you. Other questions? Please, Ståle, just take the word.
Sorry, I was trying to raise my hand, but I think it became a thumbs up. But that's pretty much what I wanted to say as well. Thank you for two very interesting presentations, and you are clearly representing networks that have come very, very far and achieved so much more than we have. My question to you would be something along the lines of what kind of relations would you like to have with networks like ours? I presented briefly what we have in Norway. It's just a loose network, but we are doing our bit of advocacy. How would you see us linked up? Do you have similar arrangements?
You're,
I don't know.
You're missing. We're missing you a little bit now, Ståle. Just.
Oh, okay.
Now
Sorry. Yeah,
now you seem okay now.
Yeah. All right. I get the sign on the screen that my internet connection is unstable. Yes. But basically, I just wanted to ask Joy and Emma how our Norwegian network would fit in relation to your networks. What kind of relationship would you like to see, and do you have anything where we would fit in? That is the question I wanted to pose to you.
I can go first if you would like. Hopefully you can hear me, even if your connection's a bit bad. But yeah, I think there's a couple of different ways that we could potentially strengthen collaboration, but I can also give you a couple of examples of how we've worked with other national networks. And I think the first thing to say is, I'm sorry, I'm going to have to try and plug in my charger at the same time as I answer this. But yeah, we through the Global Mental Health Action Network, for example, we have our working groups. So I think if there are any kind of thematic crossovers or what are the advocacy priorities for the Norwegian network, then we could look to see, are there any synergies between the work of those working groups, and how can the resources and the knowledge and the expertise of those working groups support you in your strategies. For example, Heidi already had the conversation with Ali about universal health coverage and integrating mental health into those priority areas. We've also helped in the past with the Brazilian network, for example. We've looked at how do we help them kind of strengthen their network. So any ways that we can be helpful in terms of like the governance or the structure or how we work and how we operate has been helpful, for example, in that national context. also with promotion, obviously, for new members. And we would also love to, you know, use the network to disseminate any best practice that's coming out of Norway or the Nordic countries, for example, that other countries can learn from. Is also one of the key things that happens within the Action Network also. We work also with the South Asia Union for Mental Health. So again, we've also helped them kind of develop their advocacy strategy and thinking about the different areas they're interested in. So yeah, I think that kind of covers the way that we've worked. We've also thought or are thinking about in the future to create these kind of sort of regional hubs within the network as well. So, you know, potentially if there is more connections that our European members want to build, then that could be something that we could also bring the Norwegian perspective into as well.
Thanks, Joy.
Yeah, so lots of similarities again, but like one of the main things is we try to highlight innovations and resources coming from different regions. So being able to highlight any projects, programs, research coming from your region, and then also in terms of even organizations that form part of your network, just like showing all this. These are all the organizations that fall under the Nordic network, and this is what each does, just to try and highlight, just to give more focus, or rather highlight more on what the Nordic countries do. And then also we form collaborations where we have like a specific page for collaborations. I'll try to put that in the chat. And with this, we are able to work on very specific projects with different partners. And then we are able to, be it developing of any toolkits or any documents, and then we're able to put that under like the Norway network. And this is all the resources under them, and this is what they're doing. So yeah, we're able to highlight like the network as a whole under collaborations. And also as a hub, as I mentioned, that we already have 2 functioning hubs, and we currently do not have a European hub, or yeah, we currently just have our 2 hubs. So even as a hub, and yeah, those are some of the ways. Yeah.
Wonderful. I had a concrete question. Yeah, no, one of the questions is you were saying that the Global Mental Health Network, Emma, was not only it was mostly low and middle income countries. Are there examples of high income countries who take part, and what role do they play? Are they there to support low and middle income countries, or is the intention actually that we're equal and kind of work on our issues, of course, knowing the very huge difference in resources and knowledge, but yeah.
Yes, there are definitely many high income countries involved in the network as well. And again, I think it is about countries bringing their different perspectives within these different kind of working areas. So of course, progress still has to be made everywhere in the world. So everyone's still trying to do something. And there have actually been examples of when, you know, high income countries also have things to learn from low and middle income countries in terms of like successful programs that have been implemented or advocacy strategies, etc. And of course, yeah, that knowledge sharing and that value goes both ways, I think. So yeah.
Mm. Seems people understand everything, so that's good. Or I could come with another one, and that is just in terms of the Norwegian network, that there is also, as it's a bit confusing, but there is a Norwegian network and there's a Nordic network, and there's actually a Swedish network. The Danish network we just learned is it has these very strong groups, you know, linked to the Red Cross and SAVE with mental health collaborative, etc. But they also have a network, but it's more, it hasn't been kind of very much in function. But the Nordic network has just been established based on as a result of this conference. So that has its own. Whereas the Norwegian one, and I would maybe say it a little bit different than Ståle, because I think that the thing is that what would be cool is if we utilize that capacity which is there instead of making that capacity everywhere. So utilize that common capacity and do what we do in Norway, where we don't use a lot of time and energy on that network, but we use it as a way to advocate internally, but also increase the capacity, getting others on board. Then one day we all hope that maybe we'll get a little bit of funding for this, and that can kind of, we can use it, that can be, it can be stronger. But I think utilizing that, the resources you have is extremely interesting. If just as an example, if I were to, if we wanted to kind of bring in, if it was Koshish who is now with us from Nepal, or programs that we have or ideas that we have, so that means that we can put them on the web, on the site. That would be more natural to do that on the innovation, isn't it, Emma? And then by joining this mental health network, I was part of it once, and what happened there was that you heard all the voices from around the world on how they were working, people from Africa and Asia and etc., which was very touching and also very interesting. So is that kind of one of the differences between how we use the theory?
So just to clarify, do you mean the differences between our two networks? Yeah. I mean, I think Joy's and the Mental Health Innovation Network, it's more about the innovations in programming and the kind of research element to all of that, which is of course also relevant in our network, and people will always be interested to learn and share about different programs. But I guess what our network is then trying to do is elevate that evidence base and what works in the kind of advocacy capacity. So it's definitely complementary what both the networks are doing, and we do try and work together as much as possible. But I think that's the slight difference between the two networks. And of, you know, in terms of thinking about showcasing the Nordic and the Norwegian perspective, that's where, you know, we could bring in speakers to our webinar panels. You know, we'd love to use Circle to highlight the work that's being done that other members can learn from, or get in touch with different partners from the Nordic countries as well.
Is that accurate, Joy, or do you want to?
I actually think Emma's summarized. Yeah, so we'll mostly like highlight any projects, mental health projects, resources that are released, and even organizations under, for example, Norway, that are working in mental health. It's like trying to map out if someone was to travel to Norway and they've never been, and their focus is mental health. What are some of the organizations on the ground that are working on mental health? What are some of the resources that have been released in support of mental health? And also, what are the projects that are ongoing in terms of mental health? And then now, with that background, as Emma said, we really try to work together. And then, yeah, so for their webinars and their circle that is really active every single day, like with, they try to, like for the World Mental Health Day, they were able to map out what different people were doing for that event. And different people are really conducting diverse events and, you know, celebrating the World Mental Health Day according to their context. And that was really a nice summary to see in terms of what's happening like around the world for that event. Yeah.
Cool. I think one of the just kind of a basic, and please do take the word if anyone else has something. I did my master thesis recently on collaboration, actually, on global mental health in Nepal, and linked to WHO's role. But one of the things that came up was the issue that what the parties in the actors in Nepal said was that they really liked WHO, and that was especially after the earthquake, the coordinating role of WHO. And I think this thing of kind of coordination, and what I found was that there's this Nordic word called samhandling. It's like interaction. It isn't coordination, because coordination is more telling. So coordination isn't the best word, actually. You know, it's more, we know that we're there. We don't steer each other, but we know we're there, and we utilize our common interest. And what I found was that the discussion, the increase of knowledge on the area of mental health in Nepal increased by the fact that they were sitting together and understanding each other's perspective. Instead of being one little organization there, one government there, they were together and actually doing, you know, increasing their knowledge on the need of the country in a broad sense. So I think what you're doing is really wonderful. So I think what the next step for us now, from who are participants here or listening into this, is that is to go into both your websites and actually become members. So as organizations, we can become members in both of your organizations, and it doesn't cost anything. And we can be there as individuals as well, isn't it? We can do both and, yeah. And by that, kind of using that platform and getting to learn, getting to know. Right there, Emma puts the website in the chat, and I think Joy already did. And that is kind of the way to link to those capacities. One concrete thing, if we see as a network in Norway that we have some capacity in one field, or there is a need, or one of the organizations has a capacity in one field, taking contact with you, because you have resources, especially information and graphic capacity. Is that something where you we could send a request? Can this be considered into publishing it, or making something into this that actually has that's especially to you, Joy, that can be used other places? Is that something is that a request we can come with, or is that just something you find, and then so it's more on your initiative and not on the request of members?
No, any resources that you do put out on mental health, please feel free to share, and we always put them up on the resource section of the website, and also share that. We share any new resources that have been released during the month at the monthly newsletters. So the monthly newsletters just highlight what are the recent mental health resources that have come out recently, or any innovations on mental health for this month. Yeah. So please feel free to share.
One thing is share what we already have, but collaborate with you on developing some resources. Is that also a way to be working? Yeah.
Yes, yes. We have created toolkits before in collaboration with different partners. So yes, we can develop toolkits or resources together and share.
So that means a request from us, either as network or as individual organizations, and you take that into account and respond back according to your priorities and plans and resources, etc. Yeah. Do we have anything else, Ståle? You're the only one I can see. So.
Okay. I'm the only one you can see. See if my connection holds up and if it remains. Actually, from what you have said, it is clear that you represent networks and resources that we definitely need to acquaint ourselves with and make use of and perhaps contribute to if we can manage to do that. I just want to ask the two of you with regard to your position, your vantage point. How do you see the field of mental health? Is it maturing internationally? Is it in the process of gaining a wider recognition? The reason I'm asking is, can we see that more and more countries are coming on board, and that we can leverage that with other countries, saying that, okay, your peers, your neighbors are actually taking it on board and you are now behind? Do you think it's moving in the right direction in a sense?
I can go first. A very great question, and I think it's a very varied picture, that maybe there isn't a nice round off summary that we could give on it, but of course I think, you know, we can see many countries who are making progress. Pakistan, for example, is almost gone over the line in terms of decriminalizing suicide. So a massive win in terms of also the impacts that will have in other areas, like reducing stigma, etc. But then we can also see countries like Egypt who are on the verge of going backwards and potentially criminalizing suicide again. And not saying obviously that's the only issue to hone in on, but it's just one that comes to mind in terms of thinking about the progress of different countries. And I think the same goes in terms of government spending on these issues as well. You know, as we see some countries increase their budgets, we can also see some countries decreasing their budgets. So definitely a lot of work to be done, but we can definitely see more philanthropic funders getting interested in this space, for example, which is of course a good sign. The Lancet Commission choosing to focus on stigma and discrimination in mental health, also, you know, a really big step in terms of that issue. So yeah, progress is slow, I think, but it's definitely there. And yeah, the balance can go back and forth, I think, depending on what the national context is. Countries like Denmark, for example, have recently signaled a greater spend over the next 10 years in terms of psychiatry, but of course it's not enough to deal with the issue. So baby steps, I think, in a lot of places.
Yeah, I agree with Emma that there is progress, maybe slow, but there's definitely progress, with some countries making more progress than others, but I should say, like, different perspectives. So for example, we are seeing more countries releasing mental health specific strategies, but then now we get into the implementation is something else, because it's linked to budgets, and that's a whole other story. But there are like situations where people can learn from others. So like, I'm aware there is the mental health case for investment that was done. The case for investment for Kenya was already completed, and I know WHO is working on a special initiative for mental health. So yeah, there is progress in different aspects, and countries are learning from each other. So for example, I'm using Kenya a lot because I'm Kenyan, so I have more of a context. Let me just put that disclaimer. But, you know, as Emma said, there's still the issue of suicide discrimination. And so for example, Kenya has not decriminalized suicide, but there is a mental health suicide prevention strategy. So there are some steps, but some are not. So there are opportunities for countries to learn from one another. So Kenya could, for example, certainly learn about, you know, how, like, take further steps to decriminalize suicide. But other countries could also borrow from the mental health suicide prevention strategy. And then we're seeing more and more mental health focused, be it even departments. Many ministries of health did not have a mental health department, or it was just a small unit. So that is relatively increasing, and it's also coming with a push. COVID did help amplify the mental health challenges and bring out the gap, the mental health gap in different countries. And yeah, so yes, there is progress, slow, but it's slowly like a ripple effect where different countries can learn from others. Yeah.
Thank you. I was thinking when Koshish is here, I know they're working, they are a people living with organization and very fundamental in Nepal, and I know they're working a lot with suicide. So I think you guys should be talking with your Pakistani colleagues that Emma knows of. It sounds like a good link there to learn how they were doing that. Yeah. A last point in terms of, yes, we're now in a north and south setting as well here, and that is actually one of the base of one of my questions on bringing on board people in the north, not because they have the answers, but because the discussions would be interesting to see what is here, and the adapt not adopt thinking, because I think sometimes learning from what we've done wrong somewhere else is also a smart way of kind of learning how to do it new, even though the contexts are very different. So that's also good with networks, that you can do that without it being coming there all the way down and standing there and preaching, but actually having interaction and working together. So that's something. So I don't know, is there a lot of that or less? There is more kind of development workers working in a low and middle income country, again, to Emma maybe.
Yeah, I mean, the Global Mental Health Action Network really is a cross-sector kind of perspective. So it is open to anyone to join. So we do find, you know, there are mental health professionals with various backgrounds who are joining the network, as well as government representatives, academia, UN agency, big NGOs, but then there's also grassroots, very small community project representatives, for example. So I think it all just depends on which topic it is that's being discussed, which working group, and you know, who will show up to those meetings. So the discussions can be very varied, which is one of the great parts about the discussions. But in terms of the working groups, a lot of the time it is about that kind of sharing knowledge between different countries and learning like what's worked well, what are different countries considering, what resources can be shared, and then that also kind of gets elevated into like what are some of the joint projects that those working groups want to move forward together. So for example, the financing working group right now is working on a briefing paper around innovative financing in mental health, and that's got different stakeholders, different backgrounds coming together to produce that paper. There's recently a collaboration between the Child and Youth Working Group and the Financing Working Group, and they launched a briefing on the investment case for adolescent mental health, which again had different knowledge and perspectives feeding into it as well. So it's kind of happening on two levels, I think, in terms of like the knowledge sharing and kind of collaboration, but then also working on joint outputs together, which is going to help the field, but also help other partners that they've maybe not even spoken to yet within the group.
Wonderful. I think we do have more time. Oh yeah, then Ståle can get the last question, and then we'll go in for a ending after that. Ståle.
I just wanted to ask you again a bit of your opinion and understanding and advice, as many of the participants here have some kind of connection with Nepal, and Nepal is now the 7th country which the WHO has is doing the special initiative in. I wonder, do you know what the experience is with the first 6 countries? To what extent did WHO manage to make a difference in the countries? And especially that the special initiative, what is the experience with regard to engagement of national civil society organizations interested in mental health? Do you have any thoughts about that? Because that might be quite interesting for several of us.
I actually don't know too much about it, but people in my team definitely will. So it's a question that I can take back to them for you, and they'll have more insight than I do. But I'm not sure of any. I can't think off the top of my head any partners who I've spoken to recently who've been involved. So, but yeah, I could definitely find out for you, because our team knows.
Yeah, I also don't have much information. I only know a bit on the progress that they have made, especially in Zimbabwe. And I do know that there is lived experience has also been at the forefront of that, especially in Zimbabwe. But yeah, I'm not able to like give you the exact concrete information at the top of my head. But yeah, I do know that there is like really great improvements that, or rather great strides that are happening in terms of movement to that special initiative.
It strikes me that could be a theme for a future webinar, Ståle, and invite different, not only get WHO to tell their story of how it's supposed to go, but actually get someone to tell the story about how it's actually going, or thoughts and perspectives on how it's going. Yeah. And yeah, Monette was here, but I know that also the Ukraine is one of the countries, and that is shown to be a good case in terms of actually increased or high capacity there compared to their neighboring countries, which is interesting. Eli?
Yes, I just wanted to say thank you. It's interesting to listen to you, both Joy and Emma. And I just now started to go into your web pages. I didn't do that before, probably I should, but I will definitely look more at the web pages and learn more. So just thank you for sharing. And I just also wanted to encourage our friends from Košice, if they have any questions or anything, just please feel free to speak up.
Yeah. Thank you so much for the invitation and good presentation. It is definitely fruitful for us. I would like to some update only for the special initiatives of Nepal. WHO special initiatives in Nepal. We Košice as a civil society organization. I've been participating in different program of special initiative, especially in the guideline development process, as well as planning process, and some training program of health manager training. We are all other civil society organizations also involving for this process. In these initiatives have been implementing in the all of the province, 14 district of Nepal. Our COSIS working area also in this province, so it is a good collaboration for mental health program. Thank you so much.
Thank you so much.
Thank you.
Very good that you're with us. Yeah. Yes. Is there any last minutes then? I have this big heart for networks. I really believe that there is something there that we shouldn't underestimate, and it doesn't need to be very structured and all with hundreds of indicators to be actually very, very, very important. And I think this shows. It shows in Norway we would never have been where we were had it not been for this networking. So and therefore we want to now join the more global arena to the extent that we have time and capacity. But thank you for being there, and good luck with the extremely important work, and see you online somewhere, somehow. And we'll join to become members, I think all of us, I assume. Yeah. So thanks a lot to both of you, Joy and Emma. All the best.
Thank you.
Thanks so much for having us. Nice to see you all.
Bye-bye.
Thank you. Bye-bye.
Bye.
Bye, Nepal, and bye everywhere.
Bye.
Thank you. Bye bye.
Bye-bye.